Well, thank you very much. Special place, really special place, but where I'm disappointed, I said we could have had 25,000 people if we did it outside. They said, did you see all the people outside? They all want your seat. That's the way life goes. And you're not giving it up. I know you too well. You're not going to give it up. Please sit down. Let's enjoy it. Let's enjoy ourselves. The second part of our healthcare agenda is to promote the affordability of America's needs. Thanks to our focus on lower drug prices, the FDA approved more low-cost generic drugs in my first 2 years than ever before in the history of our country. Think of that. Think of that. And every time I'd see the folks over at FDA, I'd say, come on, fellas, let's go. Faster, faster. You know, don't forget, when somebody was dying, and we had a drug that looked like it was really good, but it wasn't going to be approved for like 4 more years. It used to be 12 years. We brought it way down. I mean, it's too long, but we brought it way, way down. But a person's dying, and they said, no, sir, we can't give that because it may harm the person. I said, wait a minute, you don't understand. A person is terminally ill. They've got 4 weeks to live. And you don't want to give them a drug because you think it's going to harm them. I guarantee you I can get them to sign a document. And we got that approved, right to try. And by the way, miracles are happening, right? Miracles. Miracles are happening. Hopefully it never happens to anybody in this room, but frankly, people would go to Asia, they'd go to Europe, they'd go all over the world seeking a cure, if they had money. If they didn't have money, they'd go home and they'd die. But now they don't have to do that. And it wasn't easy because the drug companies didn't want it, because they didn't want to have terminally ill, because it looks bad on the percentage record, right? The insurance companies didn't want it because there are a lot of reasons. You know what the reasons are. Our government didn't want it because they didn't want to be sued by a patient that died that would have died anyway. So I said, here's what we do, folks. We signed an agreement, and the agreement holds everybody non-liable. We took the drug companies and we created a separate list. So they're not on that list because it is right, it's a problem. And we took a separate list. So now we have a totally separate list, confidential list, but they don't get hurt by somebody that was so sick that this person may not make it. And I got everybody to sign it, and we were done. It was pretty amazing. And then we got it approved in Congress because of these 5 great congressmen back there, including Ron, who at the time was in Congress, right? With Greg and everybody, we got it done, and we got the Senate to approve it, and I signed it, and I was really happy. Right to try. Hopefully you never need it. We also ended the terrible gag clauses that prevented pharmacists from telling you about cheaper options at the pharmacy counter. Do you believe it? I thought they were kidding me the first time. Don't forget, I've only been doing this for 3 years, okay? So, you know. These guys have been doing it a long time. But they're not allowed to talk to you about pricing. I said, wait, you got to be kidding. And they weren't. But I got rid of that. Now they can talk about pricing. You can go out and price. You can go to different places. They have to be open and transparent. That was a big deal. That was a big deal. And all these things, you know, they sound so simple. They're tough to get. They've been that way for many years for a reason. You have very powerful lobbyists. You have drug companies, frankly, that don't want that. Why would they want that? Well, you can negotiate price. Why would they want a thing like that? My administration is also working to require drug companies to disclose prices in their television advertisements, and we're almost getting to a point where we're going to be able to get that. So you're going to know what you're paying up front. They can't triple hit you. Essentially, we're holding Big Pharma accountable, and that's okay. They do just fine. Earlier this year, we announced another groundbreaking action seniors have wanted for decades. We will soon allow the safe and legal importation of prescription drugs from other countries, including the country of Canada, where, believe it or not, they pay much less money for the exact same drug. Stand up, Ron. Boy, he wants this so badly. I mean, you go to some countries and the prices like 50, 60% lower, even more than that, I guess, Ron, in some cases. And it's 50, 60% lower. The exact same pill from the exact same factory, from the exact same company. And I say, why is it that in Europe, certain places in particular, it's 25% of what we pay back here? I said, must be a different manufacturer. No, sir, it's the same one. Must be made in a different factory. No, sir, it's the same one. Everything's identical. They pay 25%. We pick up all of the research and development. We pick up everything like a bunch of, excuse me, schmucks. Schmucks. Right? Not anymore, folks, because in a little while, your governor is going to be able to go out and negotiate till his heart's content. And he's going to go to Canada. I know he's going there already, and he's looking at their pricing, and he's going to some of the European countries and others, and he's going to get his drug price down to a level that you can't believe. It's going to be a great thing, and we'll see what happens. It's going to be very interesting. And I have a feeling when that happens, the drug companies are just going to say, we can't have this, and they're going to drop their price, I think. Now, they're very smart. They may go the other way, and if they do, don't blame me, okay? But I'm pretty sure you're going to do fantastically, Ron. You feel good about it? Huh? You better do good, otherwise you're making us both look bad. You hear that, Casey? American patients must no longer be forced to subsidize lower drug prices in other countries through higher prices in America. That's what we were doing. We're paying a much higher price. My administration will never stop fighting for lower costs for American patients and American seniors. The third part of our health care vision is to provide the choice and control Americans want. We eliminated Obamacare's horrible, horrible, very expensive and very unfair, unpopular, individual mandate, a total disaster. That was a big penalty. That was a big thing. Where you paid a lot of money for the privilege of not having to pay a lot of money for the privilege of having no health care. You paid not to have health care. It was a penalty. And how it ever held up in Supreme Court, I don't know, but it did, but we just got rid of it. We just did it the old-fashioned way. We got rid of it. We vastly expanded affordable insurance options, including association health plans, short-term plans, and health reimbursement arrangements, which are incredible. And many of these options are up to 60% less expensive than Obamacare. Nobody got that. Nobody got that. That's okay. Obamacare. I didn't say Obamacare. I said Obamacare. President Obamacare. He can have it. But we've done a great job in running it. We almost had it done. We unfortunately had one vote. Middle of the night, just went thumbs down. That wasn't good. After years and years of campaigning, repeal and replace, right? But we've done a great job because we got rid of the individual mandate and we're running it better. It's still no good because it's too expensive. The premium is way too high and all of the elements of it, it's just not good. But we're coming up with an incredible plan that if the Republicans take back the House, keep the Senate, keep the presidency, we're going to have a fantastic plan. Right? Following my administration's recommendation, Florida has taken an important step to lower costs and increase choice by repealing a misguided certificate of need law used by hospitals to block competition. We encourage other states to follow Florida's example. They've done a great job right here. And I also signed, just recently, a revolutionary executive order requiring price and quality transparency. And the man who's really the leader in the world of this, it's transparency. You can pick your doctor, you can look at their records, you can see how well they did, you can go and negotiate. A man, what really sold me on it, the man who's the best in the world at it, who we used, and we gave you the max plan. Did we give that? The max plan, right? That's the maximum plan. We gave it to you. And he said something that I loved. He said, "Sir, this is more important and will go down as more important than any health care that you'll ever come up with." And I said, "I like the sound of that." Now, who knows if it's true? But I guess from what I'm hearing, they've done it in certain limited areas, and it's phenomenal. And it's really transparency, and you'll be able to negotiate all over the place, and you'll be able to pick everything you want, from the hospital to the doctor, and it's going to save you a tremendous amount of money. And there are those that say it's more important than even health care at a high level. And fourth, my administration is fighting to ensure the high-quality care that Americans deserve. Americans have to get the highest quality. So we have the highest quality that Americans deserve. On behalf of 5 million Americans living with Alzheimer's disease, I signed into law a $1 billion increase in funding for critical Alzheimer's research, and we've made a lot of progress. And just one other thing I will tell you, because it even surprised me, but we've funded it now, and within 10 years, our country will be AIDS-free. Can you believe that? AIDS-free. Tremendous progress has been made. And when we were talking about that, I said, I don't understand. How did this? It's like somewhat of a secret, but it's incredible, the tremendous progress that we've made over the last few years on AIDS and AIDS research, and we should be essentially AIDS-free. Do you agree with that, Mr. Secretary? In my State of the Union, I announced a plan to invest, as you liked it, $500 million in new treatments and cures and all of the things that we have to go through with our incredible children, in some cases, for childhood cancers. It's a tremendous problem. And to bring new hope to the nearly 100,000 Americans currently awaiting a kidney operation, I signed an executive order that will significantly increase the supply of kidneys available for transplant. It's such a big deal. It's so big you have no idea. We worked hard on that, and you know what a lot of people don't know? A lot of it is just the work. People die fairly quickly because it's not, they could go on forever, but it's unbelievable amounts of work going in all the time for step by step what you have to do. And so with kidney transplants, we're making tremendous progress, and we funded a lot of money toward it, and I think it's going to be a tremendous thing for people that are just literally suffering with something they can really do very well with. We're delivering better, fairer, and more affordable health care for all Americans, especially our cherished senior citizens. And we will stop at nothing to deliver better health care for you and for your family. I will never let you down. You have been incredible to me, and I will never, ever forget you. I will never let you down. I promise that. Thank you. Thank you very much. We're lowering the cost of prescription drugs, taking on the pharmaceutical companies. And you think that's easy? It's not easy. It's not easy. They come at you from all different sides. I wouldn't be surprised if the hoax didn't come a little bit from some of the people that we're taking on. They're very powerful. They spend a lot of money. Spend, I think, more money than any other group in the world, actually, in terms of lobbying and lobbying abilities. And I wouldn't be surprised if some of the nonsense that we all have to go through, but that I go through, wouldn't be surprised if it was from some of these industries, like pharmaceuticals, that we take on, because I don't care. I did great. I've had a great life. I want to get drug prices down. I don't care about the companies. I want to get drug prices down. I want to continue to give them the incentive to come out with new and better answers. But got to get drug prices down. And they've made a fortune over the last 40 years. They've made so much money. And they've got the system wired, because everything you do, their stock goes up. I said, what the hell is going on? Their stock just went up. They said, sir, it's going to be wonderful. I said, it's not going to be wonderful. Let their stock go down a little bit. But their stock goes up. And what we've done is incredible. And by the way, you have some incredible companies. The answer is that we want to keep them strong and powerful and wealthy, and we want them to really continue to do that research. But we got to get those prices down. They're far too high, especially when you compare them to other countries. And we want to ensure access to the doctors of your choice. And every day we are going to, as I said, we are going to defend Medicare like Medicare has never been defended again. And it's never needed the defense. It's always been incredible. It's something that worked, and they want to destroy it. In my administration, we know that Medicare is personal. Great health care is about more time with the ones you love, more days with your grandkids, and more freedom to enjoy the most rewarding years of your life, or what should be, by far, the most rewarding years of your life. You've worked hard. You've worked so hard, and you paid for it, and you've got to enjoy it. It's about getting better when you're sick. It's improving your well-being, and it's getting the treatment you need right when you need it. That's why in everything we do, we are defending the principles that made America the envy of the world and the American way of life, the greatest in our history. And our country has never been greater than it's been right now. Our military is the strongest it's ever built. We rebuilt our entire military. And even medical research is at a new level. It's at a level that we've never had it before. We stand for freedom. We stand for choice. We stand for justice and fairness and accountability. We stand for loyalty to our citizens, love for our country, allegiance to our flag, and long and healthy lives for our great seniors. And with your help, we are going to continue building the best, most advanced, most cutting-edge healthcare system anywhere in the world. We are going to expand our growing economy to make retirement easier and better and far more secure. We're going to defend American lives, American values, American families, and America's glorious destiny. There is no country like our country. We see and read things, but there is no country like our country, right? With every ounce of strength and every bit of soul, we are going to protect Medicare for you, for everyone at the villages, and for every senior across this magnificent land. You are going to be protected in many ways, but you are going to be protected. Thank you for being here. Thank you for this incredible enthusiasm. God bless you. God bless our senior citizens, and God bless America. Thank you very much, everybody. Thank you. Thank you. Come on, Aaron. Great job. Come on.
There you go.
Okay. Should I do it?
Yeah!
I'll do it. All right.
It's almost over. Is it 2 for 1? Happy hour. No.
Thank you, Mr. President.
Thank you. Thank you.
God bless you.
Bless you.
God bless you.
Thank you, everybody. Here, grab these fellas. Pass them around. The congressman don't want one, I know that. Here you go. Come here, baby. I love that. I love that. I love those guys. Bikers for 45, these guys. They've been there from the beginning, right?
That's right, all the
They've been there.
time.
Here, pass them around. Pass these around, fellas. Pass them around. Come here, Attorney General, get over here. Come on. Get over here. Lieutenant Governor, come on. Please, both of you, come on up here. They're doing a good job, right? Should we give them a pen? I think so. Come on up here. That's great. I want to thank you all. Really a special time, and this is very meaningful for me and for you and for everybody. Thank you all very much. Thank you.